Video 15, The Human Canary, the myth of Ayurvedic medicine. Ayurvedic medicine was popularized in the Indian subcontinent approximately 600 years before the birth of Christ and is a cornerstone of India's traditional healthcare system. Its origins are believed to be a mix of Persian, Iranian beliefs and Hindu ideology. It has never found favour with mainstream medicine as practiced in the West and has little research time devoted to it. The word Ayurveda is made up of two conjoined Sanskrit words, Ayur, which means life, and Veda, which means science or knowledge. Thus the word Ayurveda means the science of life. Its therapies and practices nowadays relate more to the wellness feelings and applications rather than surgical intervention. Ayurveda is a medical system which aims on a local level to harmonize the forces of body, mind and spirit with a wider belief that people, their health and the universe are all related, with health problems ensuing when these relationships become unbalanced. A person's constitution is called his prakriti, and three qualities called doshas are an important part of the prakriti. The doshas are called vata, wind, pitta, fire, and kapha, earth. And the balance of these three doshas are unique to each individual. Normally, every person has a single dosha which is more prominent than the other two, and any imbalance between the normal flux of the doshas may result in the person displaying medical symptoms. The imbalance is normally caused by an unhealthy diet, lifestyle choices, habits, mental activity, or by external influences such as exposure to environmental insults, bad weather, etc. Patients are expected to participate actively in the treatment program because changes in behavioural repertoire are often required. A goal of Ayurvedic medicine is to eliminate impurities from the body, a process which is called panchaka karma. Reduce any symptoms displayed by the patient, reduce tension, stress and worry, increase harmonious feelings. An ongoing goal is to assist with the elimination of any physical and psychological issues the patient may be facing. A suppression of natural urges is considered unhealthy and claimed as a cause of illness. The majority of people in India use some sort of traditional medicine, including Ayurvedic medicine. India has around 200 training centres offering degrees in traditional Ayurvedic medicine. Medicine is part of the Indian national healthcare system with state hospitals for Ayurveda established throughout the country. The government of India apparently supports Ayurvedic quite firmly, as recently the Minister for Ayush, Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy, Shripad Yeso Naik, has said doctors prescribing non-Ayurvedic medicines are anti-nationals. That was stated in the Times of India on April 30th, 2016. The Drug Controller General of India, DCGI, allows firms to manufacture and sell Ayurvedic medicines as long as they are recorded and described in the ancient texts. There is no requirement in India to demonstrate clinical trial data demonstrating Ayurvedic medicines are both safe and effective. The logic being that thousands of years of use is a good substitute for such scientific inquiry. Around 3/4 of the Nepalese people use Ayurvedic medicine, making it the most practiced form of medicine in the country. In Sri Lanka, there are about 20,000 registered practitioners for Ayurveda. Over 60 Ayurveda Ayurvedic hospitals and more than 200 central dispensaries. Ayurvedic medicine is also popular in Pakistan, Bangladesh and Tibet. The United States does not have a national standard for certifying or training Ayurvedic practitioners, and Ayurvedic medications are regulated as dietary supplements. Thus, they are not required to meet the rigorous standards for conventional medicines. The practice of Ayurveda is not licensed or regulated by any state. However, the National Center for Complementary and Integrative Health, the US Department of Health and Human Services, issued a warning concerning Ayurvedic medicine which states, Ayurvedic medicine uses a variety of products and practices. Some of these products, which may contain herbs, minerals or metals, may be harmful, especially if used improperly or without the direction of a trained practitioner. For example, some herbs can cause side effects or interact with conventional medicines. Also, ingesting some metals, such as lead, can be poisonous. The site also indicates there aren't enough well-controlled clinical trials and systematic research reviews to prove that Ayurvedic approaches are beneficial to the patient. In 2008, the Journal of the American Medical Association, JAMA, published a paper that examined the presence of lead, mercury and arsenic in Indian manufactured traditional Ayurvedic medications. The researchers found that 21% of the products contain levels of lead, mercury and or arsenic that exceeded the standards for acceptable daily intake. One must query why there are so few randomized controlled trials, RCTs, concerning Ayurvedic medicine. There are studies available, such as those which appear on the website of the Central Council for Research into Ayurvedic Sciences, the leading body for promoting Ayurvedic medicine. But these don't follow established trial protocols and are poorly designed. So the results are quite meaningless. As a treatment option with an approximate 5,000-year history overall, surely this form of medicine must be considered ripe research material. Why hasn't this happened? Maybe the world of medical science is not structured to seriously consider treatments that use incantations, amulets and fallacies as part of a core belief system. As a consequence, research grants to study Ayurvedic medicine are a rare event. Also, science is not enamoured with proofs that consist of anecdotal evidence and unsupported testimonials, because these belong to the era of the snake oil salesman. There is also some evidence that firms which sell over-the-counter Ayurvedic drugs can purchase positive results for a price. Why then is Ayurvedic medicine so popular in India, Nepal, Pakistan, Tibet, Bangladesh and Sri Lanka? It is because such countries are home to many impoverished, needy and destitute peoples, and Ayurvedic medicine is a service within the reach of most, whereas access to modern forms of medical advice and treatment is outside the reach of so many. Please hit the subscribe button if you want to learn more about the myths surrounding medicine. It's a little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike this video.